The fountain of youth. We are still looking for it, that elusive fountain of youth. Ever since antiquity, man has realized his vulnerability. He or she grows old, and hence he or she has sought to remain young for as long as possible. The search for fountain of youth has taken man to many places, from the Canary Islands to Japan, Polynesia, and England. Then there was the legendary Prester John, who is an Ethiopian king who presided over the Christian kingdoms of Asia Minor. He was reputed to rule over land that ran at the river of youth. Then there was Ponce de Leon. He was a Spanish conquistador in the 15th century and the governor of Puerto Rico. He was associated with a supposedly fountain of youth in Florida, USA. It was supposed to cure sexual impotence, a major preoccupation that time. There are many theories why we age. Cells sustain damage with time. Our cells come across damaging materials like chemicals, radiation, germs. Then there is simple wear and tear. A more active person will face faster degradation than a sedentary one. Some people may be genetically more prone to age faster, and free radicals can be harmful to the body. Some people are exposed to greater amounts. With age comes greater wisdom and experience, but also increased frailty and morbidity. There is no standard deviation of geriatric trauma. Studies have included subjects as young as 45. What is important is the physiological age rather than the chronological age. A person can be physiologically young and fit, even though that person may be chronically old. And falls is the second most common mortality after road traffic accidents. The truth is that people are living longer. The population is getting older. Since 1960, life expectancy has increased by about 20 years. 5 years more in females than in males, because women live longer than men. Lifespan is now about 82 years old. This has led to increased bone fragility. Fall prevention measures can be personalized to minimize these falls. The American Geriatric Society recommends annual screening for those aged 65 and above. With increasing age, there is slower healing. There's less ability to compensate. Nutrition is poorer, and there are other changes in body composition, such as an increase in fat composition and a decrease in muscle mass. In other words, we get more flabby and less muscular. A case study. A 55-year-old man was doing a debrief in Cambodia after a 4-year project setting up a trauma center in Cambodia. In 2017, he suffered a severe headache while doing the debrief. An emergency CT scan in Cambodia showed an intracerebellar bleed. He was operated urgently in Cambodia and then airlifted to Singapore for rehabilitation. That patient is me. The bleed was in the intracerebellar region, and this has left me unsteady, and I walked like a drunk. My vision was also affected, and that is why I use a walking stick. But my intracerebral region was fairly intact, so my thinking and teaching was fairly intact. Neurological changes like stroke, traumatic injury, various dementias are usually harmful. These patients are often on medication which can predispose to morbidity. On 2 separate occasions, I had rib fractures and an avulsion fracture of a tibial tubercle because of immunosuppression use. However, they can also be protective as the patient is more aware of his vulnerabilities. For the cardiovascular system, you can have arrhythmias and heart failures. Some patients can have multiple medications which can interact with each other. Carotid sinus syndrome, which is characterized by syncope, usually in older males with cardiovascular symptoms. The etiology is unknown, but then the fainting spells can give rise to falls. For the respiratory system, chronic obstructive pulmonary disease is the most common, with its associated pneumonias. These are the issues associated with the GI tract. Cancers of advancing age, especially colorectal and upper GI cancers. The patient may have to take supplementary vitamin D to strengthen the bones. I had to take vitamin D after my fractures. Then there are changes in bowel habits, and you have to rule out cancers because of age. BPH, or benign prostatic hyperplasia, and frequency will be a problem with males. This may predispose to falls as the patient gets up more frequently to go to the toilet. In females, there is a problem of uterine vaginal prolapse and a very bulky sensation in the pelvis. Anemia seems to be a problem in the elderly, and this may aggravate the propensity for falls. Malignancies, which is a concern for older patients, may also cause patients to be anemic. The elderly are slower to respond to any changes in the body. They have more autoimmune diseases, and healing takes more time. So, rib fractures have a greater morbidity in the elderly. So, in conclusion, morbidity and mortality will increase with advancing age. Anyone with a serious injury should be treated in a trauma center. They have a better outcome being treated there. There must be a high level of suspicion. Patients will not tell you what the injuries they have, and the impact may be more than what is to be expected in a younger patient. And finally, be aware of geriatric abuse. The elderly can be abused without them telling anyone. It requires a high level of suspicion. Thank you for listening.